Welcome to MLT Education Point, and today we are going to talk about term used for high and low count of blood cell. So let's get started. Terms used for high and low red blood cells. Red blood cells are also called erythrocytes, and the normal count of red blood cell is 4.5 to 6 million per millimeter cube. But when there is increase in the number of red blood cells in the blood, we use the term polycythemia. And polycythemia is also known as erythrocytosis, means having a high concentration of red blood cells in your blood. Polycythemia makes the blood thicker and less able to travel through blood vessels and organs. And many of the symptoms of polycythemia are caused by the sluggish flow of the blood. Next is the erythrocytopenia. So this term is used when there is a decrease in the number of red blood cells in the blood. So erythrocytopenia is a low number of red blood cells in the blood. When there is a decreased count of red blood cells in the blood, we use the term erythrocytopenia. Next is the term used for high and low white blood cells. White blood cells are also called leukocytes. The normal count of white blood cell is 4,000 to 11,000 per millimeter cube. We also use some terms for the high and low count of white blood cells in the blood. If there is increase in the number of white blood cells in the blood, we use the term leukocytosis. So white blood cell count higher than 11,000 is called leukocytosis. So leukocytosis means you have a high white blood cell count. This means you have more WBCs than normal. And leukocytosis is a normal immune response and is not always a cause for concern. Most of the time it means that your body is fighting off infection or inflammation. Next term is the leukopenia. So leukopenia is the decrease in the number of white blood cells in the blood, or WBC's count lower than 4,000 is called leukopenia. So leukopenia, a low white blood cell count, is called leukopenia, is a decrease in the disease fighting cell leukocytes in your blood. And the third term is the leukemia. So leukemia is a blood cancer caused by a rise in the number of WBCs in the blood. Next is the term used for high and low neutrophils. So neutrophil is a type of white blood cell, and neutrophil is also called granulocytes or polymorph nuclear leukocyte. Normal count of neutrophil is 40 to 75%. We use the term neutrophilia if neutrophils are higher than normal, greater than 75%, then we use the term neutrophilia. So neutrophilia, a high neutrophil count is called neutrophilia, and neutrophilia is also called neutrophilic leukocytosis. It can be caused by a lot of different conditions including infection. This is the most common cause of the high neutrophil count, and most bacterial infection cause a high neutrophil count, but not all of them do. Next term is the neutropenia. So neutropenia, if neutrophils are lower than normal values, that is less than 40%, then condition is called neutropenia. An abnormally low level of neutrophils in the blood is called neutropenia. A drop in neutrophil blood levels typically occur when the body uses immune cells faster than it produces them, or the bone marrow is not produces them correctly. An enlarged spleen may also cause a decreased neutrophil level. Next is the term used for high and low eosinophils. So eosinophil is a type of white blood cells, granulocytes. So eosinophil is also called acidophil or eosinophiles. Normal count of eosinophil is 1 to 4%. The term eosinophilia is used when there is the high number of eosinophil more than 4% is called eosinophilia. So a count of more than 500 eosinophils per microliter of blood is generally considered eosinophilia in adults. And the next term, eosinopenia, is used when there is low number of eosinophil than normal, that is less than 1%, is called eosinopenia. Terms used for high and low basophils. Basophil is also a type of white blood cells, also called granulocyte, and normal count of basophil is 0.5 to 1%. Basophilia term is used when the basophil count is more than 1%, then it is called basophilia. So if your basophil count is unusually high, then it is called basophilia. And basophilia may be a sign you have an infection, or it may be a sign of serious medical conditions like leukemia or autoimmune diseases. Next term is the basopenia. So basopenia means basophil count is less than 0.5%. So a low basophil level is called basopenia, and it can cause by infection, severe allergies, or an overactive thyroid gland. Terms used for high and low lymphocytes. Lymphocytes is also a type of white blood cells, but it is agranulocytes. So the normal count of lymphocytes is 20 to 40%. And the lymphocytosis term is used when the lymphocyte count is higher than normal values, that is greater than 40%, is called lymphocytosis. So lymphocytosis or a high lymphocyte count is an increase in WBCs called lymphocyte. And the next term is the lymphocytopenia. So lymphocytopenia is occur when the lymphocyte count is lower than normal value, that is less than 20%, then it is called lymphocytopenia. Next is the term used for high and low monocytes. So monocyte is a type of white blood cells, and it are agranulocytes. Normal count of monocyte is 2 to 8%. And the term monocytosis is used when there is higher than normal values of monocyte, that is greater than 8%. So monocytosis, an increased number of monocytes in the blood, and it occurs in response of chronic infections, in autoimmune disorders, in blood disorders, and in certain cancer. And monocytopenia, if the monocyte count is lower than normal value, that is less than 2%, then it is called monocytopenia. So monocytopenia occurs when your monocyte count is too low. This is the result of decrease in your WBC's count, and the cause of the monocytopenia include aplastic anemia. Terms used for high and low platelets. Platelets are also called thrombocyte, and normal count of platelet or thrombocyte is 1,50,000 to 4,50,000 platelets per microliter of blood. We use the term thrombocytosis if the platelet count higher than 4,50,000. We use the term thrombocytosis. So thrombocytosis is a condition in which you have a high blood platelet count. The next term is the thrombocytopenia. So thrombocytopenia is the term used when the platelet count is lower than 1,50,000, is called thrombocytopenia. So thrombocytopenia is a condition in which you have a low blood platelet count. If you understood this video, please like, share and subscribe to my YouTube channel. Thank you so much for watching.